If we say that every hospital or every organization, healthcare organization has its own culture, they're going to have to really decide how that fits into their overall plan. I think there's obviously great upside value. Everything that I've seen, read, experienced shows that there's extreme upside value to engaging in interactive technology. I think it needs to fit into a hospital strategy, and how they use that is going to be part of that overall.
The workflow in a hospital where there's no Skylight is much more labor intensive. The Skylight system and the application bring a supportive reminder to the hospital's workflow, to the nurse's workflow. It doesn't change the workflow, it only supports them by automating a number of tasks that the nurses have to take care of themselves, such as delivering patient education and, better yet, documenting patient education. Nurses are very good at educating their patients as required. We do it all the time, we do it without thinking.
And so our initiatives with Skylight is looking at improving that discharge or transition plan to home, to a subacute area, how to provide education to patients, families, and the community on wellness and life choices before they ever get sick. In addition, we are utilizing them in several initiatives in improving the process and outcomes within the hospital, preventing errors from ever happening. How do we prevent infections from occurring in the hospital? As we all know, that is one of the drivers of increased cost in healthcare, is when patients come to the hospital, they get sicker than before they came in.
It's about getting that caregiver to sit down and take some time with the patient and family to talk to them about what it is that's important. And what's important to the patient and family has to be important to us for us to be successful. Skylight uses that data that's been harvested and tested, and they give us that data back, and that's how we're proactive in our approach.
Interactive technology can drive right at specific HCAHPS questions. I mean, HCAHPS is sort of a tactical response to addressing the measurement of patient experience. But when we begin to look at the key elements of HCAHPS in particular, interactive technology can be set up to truly address those issues.
Skyline is great in ensuring that they are not an added task that needs to be done each day. They understand that if we add one more thing to someone's plate, that the engagement will go down. So Skylight's driving goal is to ensure that whatever they're going to implement helps reduce the workflow on the people that will be using the system. And when it comes to medications and side effects, that's certainly an area that we've been able to benefit from.
We find that very quickly as our nurses support it and our nurses endorse it. Patients are watching. We have a new fall video, and we've seen our falls really drop dramatically in the last 2 months. So we're very satisfied with how we're seeing some initiatives related to patient safety being affected positively by using Skylight.
We have a great account manager who is at our beck and call. He helps us with any of the tools that we want to add onto Skylight. He brings me ideas about best practices that are being implemented around the country by sharing things that are happening everywhere else. The service folks that I work with are just fabulous. They make regular visits. They are always on site in our hospitals when they need to be. So I am a great advocate of Skylight because of what it can do, but also because of the support that they provide us.
Within a period of 6 months, our HCAHPS scores on our medical surgical department as well as oncology rose 10 points on pain management as a result of push messaging for pain management and creating the alternatives and solutions that would enable different things like a warm blanket, relaxation videos, or diversion therapy directly to the patient's bedside.
I think Skylight has been an excellent partner for us. They are extremely responsive to us. They'll sit there and listen to us, brainstorm and think of all kinds of things, and then they'll help us figure out how to implement those. Not only do they help us figure out how to implement them, but they help us figure out how to streamline our workflow so we can make it simpler and smoother for the nursing staff.
The benefit of Skylight is that it supports the workflow in that it can document the patient education automatically, which takes one of the tasks off of the nurse's shoulders and actually make sure it's compliant with this automated documentation.
We've actually hardwired some of the Skylight education information into our electronic medical record. So a patient will watch a videotape, they'll answer some questions, and it actually gets automatically documented into our EMR. So that has removed one step in the process for the nurse, that they don't have to do that anymore.
I'm on the other side of the states, technically. We are 3 hours away from Jersey. And I've been actually communicating with my staff from all the Skylight alerts that have been coming through my BlackBerry.
So you're able to take care of patients here?
From here. So I can actually send the alerts back to my reps, tell them, please see this patient, they're having this issue, or they're dealing with a couple of issues that are going on. My rep will actually go in, see the patient, take care of the patient, do service recovery, report back to me. And I already have everything documented in my BlackBerry. So when I get back to work on Monday or Tuesday, I already have a report of all the patients that came in through the Skylight alerts while I've been here in San Diego.
In fact, I mean, I think the adapters of interactive technology are innovators in terms of looking for new ways to address patient experience.
The thing that I'd say Skylight does from a solution perspective is provides the journey of care support. And what I mean by that is there's various points of when a patient may need health care. You could know you have elective surgery, or you might not know an unplanned event that sends you to the hospital. Our solutions pick patients up at that entry point into healthcare and support them all the way through their hospital stay and even when they've gone home.
What Skylight allows a hospital to do is focus the clinical resource on the people, on the patients that require the attention at any particular time. So the value that Skylight brings its partners, at a high level, it allows them to apply technology in their particular facility, their hospital, so that they can better provide a quality experience for their patients. At a very specific level, Skylight helps them achieve very high ratings from their patients that allows them then to get maximum benefit.